I'm Dr. Joe Iser, Chief Health Officer of the Southern Nevada Health District. The 2014 Ebola epidemic is the largest in history, affecting multiple countries in West Africa. In the United States, there have been imported cases, including 2 deaths, and healthcare workers who have become ill. The Centers for Disease Control and Prevention, its federal, state, and local healthcare partners, are taking precautions to prevent the further spread of Ebola within the United States. Ebola is a rare and deadly disease caused by infection with one of the 5 Ebola virus strains. Of the 5 identified Ebola virus species, 4 are known to cause disease in humans. Symptoms include fever, headache, joint and muscle aches, weakness, diarrhea, vomiting, stomach pain, lack of appetite, and abnormal bleeding. These symptoms may appear anywhere from 2 to 21 days after exposure to the virus, although 8 to 10 days is most common. The mortality rate can range from 25 to 90%. The current mortality rate for this outbreak is about 50%. The current outbreak originated in Guinea in March of this year and is the largest in history. Other countries that continue to report active cases at this time include Liberia and Sierra Leone. The Congo is experiencing a separate but controlled outbreak, and Nigeria and Senegal are reporting no current transmission, and people entering those countries are not at risk for exposure. For up-to-date information on case counts in affected countries, visit CDC's website at cdc.gov. Ebola is transmitted through direct contact with the blood or bodily fluids of a person who is ill, or through exposure to objects such as needles that have been contaminated with the bodily fluids of a person who is ill. It is not a respiratory illness like the flu and is not spread through the air. It is also not spread through food or water. People who are not symptomatic are not infectious. In order for the virus to be spread, an individual would have to have direct contact with another person who is experiencing symptoms. Currently, there is no specific treatment or medication to treat patients with Ebola. Standard treatment for Ebola illnesses remains mostly supportive. However, the National Institutes of Health and the Food and Drug Administration are leading the effort to develop and test vaccines and new treatments. In an outbreak, contact tracing is one of public health's most important functions. The goal is to quickly identify everyone who had direct contact with a sick Ebola patient and observe those individuals for 21 days after the last contact occurred. This was done successfully in Nigeria and more recently in Senegal, where the outbreaks have been successfully halted. This Ebola virus disease algorithm was developed by the Health District's Office of Epidemiology to determine whether patients should be tested for Ebola, and is based on current guidance from CDC. It is revised as new guidance is received and used in consultation with healthcare providers. The CDC performs all confirmatory testing on patients that meet the algorithm's testing criteria. All appropriate federal regulations are followed when transporting samples for testing. The Ebola virus is effectively killed with disinfectants such as simple household bleach. However, the virus can survive for several hours on surfaces such as doorknobs and countertops, and for several days in body fluids such as in blood. The CDC has issued guidance for the types of personal protective equipment that should be worn in patient care settings, as well as guidance for donning, putting on, and doffing, taking off PPE. Additional types of PPE may be required for special situations, including procedures that generate an aerosol or droplets, such as while intubating a patient. Non-healthcare workers who may come into contact with an ill person should use the standard safety precautions they would normally take when dealing with a potentially sick person. Avoid direct contact with the person's blood or bodily fluids. It is important to remember the virus is not spread through the air. Locally, the Fire Alarm Office dispatch for Clark County, the City of Las Vegas, and North Las Vegas. These entities use a tool developed by the National Academy of Emergency Medical Dispatchers to screen calls and identify travelers to West Africa plus symptoms of Ebola virus. If a person meets these criteria, an automatic message is then sent to the EMS crew which reads, "Patient has screened positive for possible Ebola. PPE required, such as gloves, gown, goggles, N95 mask." Similar systems are in place for the other municipalities in Clark County. EMS providers repeat the screening once they arrive at the patient's location. If the second screening were to indicate the potential for Ebola disease, the receiving healthcare facility would be pre-notified to allow the implementation of all necessary safety protocols. The EMS screening tools are based on CDC's interim guidance for EMS and are reviewed and revised as needed. The Southern Nevada Health District has an infectious disease response plan in place that is applicable to communicable diseases such as Ebola. The Health District began meeting with community partners in August to ensure its readiness to respond to a suspect Ebola patient. In Clark County, there is an all-hazard approach to planning with a basic plan that includes threat-specific annexes such as responding to a disease outbreak, earthquake, flood, or other community-wide emergency. The Health District works with its community partners, including the county, cities, fire departments, law enforcement officials, hospitals, and others, to exercise the plans in order to test and refine our systems to ensure we have the needed resources in place to respond to real-world events impacting our community. While Clark County is a high-volume visitor destination, McCarran does not receive any direct flights from Africa. Our systems were tested when a passenger became ill on a flight. It was discovered the passenger did not have the corresponding travel history, but the incident provided a variety of agencies with the opportunity to work through the procedures in place and to make enhancements to our systems. The Southern Nevada Health District continues to work with its community partners as the Ebola outbreak evolves. Staff is available 24 hours a day, 7 days a week to assist healthcare providers. If the public has questions or concerns about Ebola, they can call the Health District's information line at 702-759-INFO. The information line is available Monday through Friday from 9 a.m. until 5 p.m. Additional information for the public and healthcare providers is also available on our website at snhd.info/Ebola.